start with the why children's healthcare, where we started. I wanted to come back and start a children's hospital, but there are two things which actually struck me. It is a hospital where conceptually it is very, very different from a multi-specialty hospital. So children's hospital has got to be focused on children-centric, and also the entire environment for children's hospital have to be very different. Gadgetry is largely different, and also conceptualizing the children's healthcare largely depends on the doctors. The engagement of the doctors is very unique. They got to work to a full-time model, and commitments are 24 hours because children's healthcare is a 24/7 healthcare. The most of the admissions come through the day and also as well as night. So therefore, conceptually, these two things are got to be right. That's what I understood visiting across the world and also working in London. So with that model, we have been kind of nurtured and also strengthened children's healthcare. Today, we are India's the leading pediatric multi-specialty children's hospital with 1,500 beds in 6 cities and 14 centers. So our core offerings are pediatrics, pediatric multi-specialty, pediatric intensive care services, and pediatric quaternary care. So Birthright by Rainbow is an integrated obstetric vertical, and the delivering babies within the children's hospital. So what we believed in is that in any MCH large model, childbirth is always safer and better in a children's hospital. So we have before pandemic, we were kind of seeing about close to 1 million outpatient footfalls and well over 67,000 inpatients. Very significant number of patients have been admitted and treated in children's intensive care services. Almost 1/5 of the total admissions have been admitted in intensive care services. We have 600 doctors across the group who are full-time and with a night on-call commitments. So we've been recognized very well in the last 20 years' time. We entered in Guinness Book of World Records in 2016 for gathering the largest number of preterm babies treated by one hospital, that's in Hyderabad city. And also we entered in Limca Book of Awards for saving the Southeast Asia's smallest baby with 375 grams in Hyderabad city again. So we have also been awarded as the best children's hospital of the country on many occasions by CNBC TV 18 along with the ICICI Lombard at a national level, and the Week surveys, the Times surveys, and the FICCI awards. So this is the kind of 2 decades of building a robust children's healthcare along with the perinatal services. First 10 years, we largely spent on conceptualizing and building modeling the children's healthcare with a strong intensive care services and building a specialty services for children, and also integrating obstetrics within the children's hospitals. We also had an expansion outside Hyderabad city to our neighborhood city called Vijayawada. So in the next 10 years, we had an exciting journey of adding 1,250 beds in various geographies, like moving to Bangalore. We built India's first designed greenfield built-to-suit children's hospital of 200 beds in Bangalore city. And then with 2017, we started operations in New Delhi, 2019 in Chennai city, and 2021 in Visakhapatnam. So this along this journey, we also added several spokes in Hyderabad city as well as in Bangalore. The capex for all these expansions have come from the funding raised from the CDC. CDC is the UK government-owned private equity firm, which funded in 2 tranches, 2013 and 16, of total of 200 crores plus 50 crores of debt. The rest of the money is actually raised from the internal accruals. So all through the expansions, we have been profitable, never lost a sight on profitability. So these are our hospitals across the country. We have 6 hospitals in Hyderabad city. So one being the cardiac center, 100-bed standalone heart center in Hyderabad city, 3 hospitals in city of Bangalore, 2 in New Delhi, 2 hospitals in state of Andhra Pradesh, Vijayawada and Visakhapatnam, and we have one hub hospital in Chennai city. So built on our core values of care, compassion and commitment, we delivered excellent outcomes for all the stakeholders. For the community, we are a one-stop solution for complete comprehensive children's healthcare. Through the hub and spoke model, we enhanced our capabilities to cover across the city through our the robust transport networks as well as the 24/7 consultant-led services. And we have been awarded as a great place to work for the last 3 years consecutively, 20, 21 and 22. And doctors, we have a very unique doctor engagement model. So our doctors work completely full-time to Rainbow, and we work in the teams, we don't work in silos. So the significant number of doctors are equity partners, about over 100 of our doctors have been equity partners in our organization with a 16% of total equity. So what we believe in is that for investors is that what the model Rainbow is modeled on asset light model with a minimal debt equity ratio, delivering a strong operating as well as a financial performance has been the key. We've been paying the dividend regularly for the last 10 years up to 20%. We have been very strong on delivering environmental, social and governance initiatives. CDC is a DFID, so they are quite aligned in delivering the ESG initiatives. 3 of our hospitals have been EDGE certified for initiatives which we have taken to reduce the power, reduce the greenhouse gas emission and also water conservation. Our board is professional, independent and diverse. Our governance standards have been extremely impeccable, and that's something which has been brought by CDC to our hospital. The key investment highlights are, so India has a large addressable pediatric market as well as the obstetric market. We being a child-centric hospital with the capabilities to do multi-speciality pediatric care and also comprehensive perinatal services, we have a huge opportunity to grow within the country. And we have a proven doctor engagement model. So most of our doctors are full-time, and also we have the ability to kind of train and retain our own students, being excellent. The comprehensive pediatrics and obstetric models have certain advantages. We exploited the complementary nature of these specialities and built a very strong and robust perinatal services, which has been growing about 25% CAGR year on year last 5 years time. Hub and spoke model being something which we discovered over a period of time. This is for the cities, Indian cities which are very large, like Bangalore, Hyderabad, Delhi. These cities requires a much larger footprint to cover the city through the hub and spoke model. This has been very successful in Hyderabad city and trending well in Bangalore. So having an investor for 9 long years, which has really helped me to scale our operations and also demonstrate our profitability. I mean, as we know that India still spends very little per capita, about $73 we spend per head for the expenditure and for health. The large sum goes to the private health care. However, there is an increasing urbanization to the 40% by 2030 and also the rising per capita income. For us, most importantly is that pediatrics and obstetrics is that, the huge nuclearization of the Indian families, like most of the young families, and also these families are well aware of insurance and also significant insurance penetration. So these are the macroeconomic tailwinds leading to the massive increase in the total addressable market. The addressable market in 2020 is about the $18.5 billion for the pediatrics and obstetrics, which is expanding to $36 billion by 2026. So the private market is growing at a $22.3 billion, which is almost doubling from 2020. So 14% growth for the pediatrics CAGR and 12% CAGR for the obstetrics. So this is a huge opportunity to build out a pediatrics and obstetric model. We always believed in Childcentricity. I think building a hospital for child-friendly environment and also make them feel comfortable within the hospital. So the fear is something which we need to elevate from the children. So therefore, all our hospitals being very spick and span. We do spend significant amount to address their needs as a play areas and also concept designs within the children's outpatient department, even in inpatient areas where we actually make it very congenial for this is a very, very important factor for children who are actually recovering from the serious illness, both emotionally, psychologically, to have a better environment. So on competition, as per the CRISIL, the Rainbow clearly has a dominance over other maternal child healthcare players. So though there's no like-to-like competitive hospital for Rainbow Children's Hospital, because our nature is more multi-specialty children's hospital, whereas the other players who are there in the market, who are there in the industry, are more of pregnancy focused, like childbirth focused players like Cloud9, Motherhood and Cradles. So whereas Rainbow focus pretty large on the pediatrics and obstetrics as well. 1/3 of our beds are actually allocated to the intensive care services. That shows that our strength in the children's health care. And also we have commitments to build a multi-specialty care as well, like including all the specialities within the children's hospital, especially hub hospitals. So this is an important slide, which what I believe is that, so we as a Rainbow Children's Hospital, where are we positioned in Indian healthcare scenario? On the left side of the slide, we see that the focused single specialty chains like mother and child hospitals, and also adult single specialty hospitals like orthopedics like Shelby, and cancer care chains like HCG. And whereas on the right side, we have all the multi-specialty hospital like Apollo's, Max, Fortis and Narayana. So the Rainbow is not a single specialty hospital. It's a pediatric multi-specialty hospital. That's where we envisage, that's where we're building it, that's what our future is going to be. We are a mirror image of a multi-specialty adult hospital with the offering to do to cover perinatal services, which believe in obstetrics to be in the children's hospital. So we are a large pediatric multi-specialty hospital and perinatal services. That's why the Rainbow is uniquely positioned in this country's healthcare scenario. We offer complete spectrum of pediatric services, right from primary care to secondary care to the tertiary care. Some of our tertiary care services in the hub hospitals are as big as like a 50 to 60 bed level 4 newborn intensive care services to 25 to 30 bed pediatric multidisciplinary intensive care services, with all the facilities like ECMO services, dialysis, as well as kind of high frequency oscillation, total body cooling. These are all very important to back up the children's multi-specialties. For example, children coming with the coma, status epilepticus, children coming with the liver failures, children coming with the multi-organ failures. So that kind of a backup facilities are required in our intensive care services, and also to support the organ transplant services like a liver and bone marrow transplant services. I would want to present some of the specialities, how the scale of the specialities. For example, in our Hyderabad Hub Hospital, Pediatric Hemato-Oncology Department, this is about, we treat about 200 new patients newly diagnosed childhood cancer patients every year. At any given time, we have 500 plus patients who are undergoing the cancer care treatment in our unit, which is a 22-bed dedicated oncology unit. And also we do a 27 average bone marrow transplants per year in this unit. Very large volumes of pediatric hematology work we do. It is headed by 3 consultants, and also we have a training service. And similarly, that pediatric neurology department. So we have one of the country's largest pediatric neurology and department for children. So with headed by 4 consultants, and we see about 3,000 patients across every month with acute care and chronic neurological care patients, and also we undertake complex surgeries for childhood epilepsies. I would like to present the Children's Hospital in Hyderabad city. This is our hub hospital in Hyderabad. This is a 250-bed children's hospital, which this is a new hospital we moved in 2018 because our earlier hospital was kind of falling short of space for to accommodate more specialties and growth. So this hospital, I would say, we can compare this hospital to any medium-sized hospital in the world, like a Cincinnati Children's Hospital or Texas Children's Hospital, or even Liverpool Children's Hospital. So the kind of one is scale, number 2 is operations. More importantly, operational wise, we have a 25 pediatric specialties in this hospital plus perinatal services. This hospital has got a 60-bed newborn intensive care level 4, and it has a 30-bed pediatric multidisciplinary intensive care services. And we run all the specialty programs in this hospital, and also we run a transplant services for liver transplantation, renal transplantation, and bone marrow transplantation. So we also have a kind of a large transport retrieval services from this hospital, like the transporting children not only from Hyderabad city. We go across all over Telangana, some parts of Andhra Pradesh, to pick up the newborns and sick children for the critical care treatment. So we also go up to the Parbhani district, which is Nanded area, and also northern part of Karnataka to bring the sicker children through our transport systems. So we have a large training program as well for training up the pediatric DNBs as well as the postdoctoral fellowship programs as well, which is why this is a kind of what 22 decades of our the teamwork resulted in that world-class children's hospital in Hyderabad city, both in terms of facilities, offerings, as well as the results where we can compare it to ourselves to the best of the hospitals. We have always had a dream of a children's heart center. So that was actually we've been able to do it in the recently. The Children's Heart Center is about 2.5 years old. This used to be our previous hub hospital in Hyderabad city, and it's a 100-bed standalone pediatric heart hospital. So we're fortunate to have a very senior cardiac surgical team joined us, believing that standalone cardiac surgery Pediatric Heart Institute would be able to deliver a better care. So for the last 2.5 years time, we were able to kind of do a large number of pediatric cardiac surgeries, well over 800 cardiac surgeries, as almost equal number of cardiac catheterizations. We also offer very unique service from this hospital called detecting the cardiac anomalies in the pregnancies. This service we not only offer to our hospitals, we also offer to other hospitals as well. So detecting the cardiac anomalies in pregnancy is such an important thing, which we do that. Very, very appreciated service in Hyderabad city. So doctor engagement model. So this is where we are very, very different from other hospitals. Almost all our doctors are full-time doctors, which means they have no private clinics, they have no home clinics, they completely work for Rainbow, and also they have a night on call commitment as well, because of an emergency because of our hospital is an emergency in nature. we work in the teams. We do not work in silos. All the doctors work in the teams, like in intensive care teams, both PICU teams, NICU teams, specialty teams, pediatric teams. So that results in actually better quality of care to the patient, better outcomes as well. So the doctor engagement model has always been the institution first approach what we have taken. Therefore, what people look at us is that, go to Rainbow rather than go to a doctor. So our doctors are very well recognized, but Rainbow is the one which is actually a destination when it comes to the patients where to go. So the infrastructure is something has been excellent for all these doctors for them to grow, and also that we run academic programs. We also run the examination for the Royal College of Pediatrics, United Kingdom. So they regularly conduct exam, taking the Rainbow's help in Hyderabad city. We have at any time 200 plus doctors in the training program for the pediatric residency program, which is DNB Pediatrics, as well as the postdoctoral fellowship programs in the pediatric intensive care, newborn intensive care, all other specialties as well. We also publish significant number of research papers in the listed journals, both nationally and internationally. Very similarly, like what we have done in pediatrics, and our obstetrics is also completely full-time model. All our obstetricians work full-time with us and also with the 24/7 commitments. Dr. Pranati Reddy, who is an obstetrician, she's alumna of Royal College of Obstetrics. She joined in believing the philosophy of to build a perinatal services in children's hospitals. So that's been successfully introduced in 2007, and today we are one of the largest obstetrics services in the country. Pediatrics and obstetrics are complementary specialties. When you have such a strong systems where there's a full-time models and also intensive care services for both women and as well as children, so that will become a very effective place to deal with the high-risk pregnancies. In the present day, clearly there's about 10% of the pregnancies are becoming high risk because of the lifestyle, late marriages, and also personal habits. So this is something that, the high-risk pregnancies are, our system is probably the best place to address. In the pandemic times, we have actually been able to treat a lot of the high-risk pregnancy women with the COVID problems. Hub and spoke model. So typically our hubs are about 200 to 250 bed size, and the spokes will be about 50 to 75 bed size. So what happens is when you have become successful and the children coming to one place from all over the city becomes difficult. One is transportation, accessibility, and also emergencies. Therefore, we have taken a step to kind of start spokes to address these problems, especially in the areas which are fast growing and also difficult areas for the access wise. We have done the spokes. Through the hub and spokes, what we were able to do is we were able to reduce the outpatient footfalls into the hub, do quality services in the hub, and spokes does a lot of outpatients, emergency services, secondary care pediatrics, obstetrics, and also newborn intensive care. So any complexity from the spoke, we refer them to hub. We transport them to hubs. So from the hub hospital, all the neurologists, nephrologists goes to the spokes and do the outreach clinics. This whole system is so complementary, and also that it's actually been the hub and spoke model resulted in a huge reputation for Rainbow in Hyderabad city, and it's tracking very well in Bangalore. Very similar to what we have done hub and spoke. We are in Hyderabad for well over 2 decades. In Vijayawada last 1.5 decades. We have been in Bangalore last 6 years, in Chennai 3 years time. So Rainbow is a household name in Telugu states, as well as kind of the neighboring parts of the Chennai and Bangalore. So what we see is that there is a huge scope for us to connect these cities through the dots. Those dots are actually some of the regional places like Rajahmundry, Kurnool, Nellore. These are all very potential places where Actually, there is a, if we can actually connect these dots, we can include very large population into our network, and then expand and get large population, both the women and children, and for the specialty care, and most importantly for emergency care, we can actually drive more effectively. What we are trying to see is that connect these 4-5 cities of the south and have a better access to the patients, and also patient will be able to reach you with emergencies much more quickly. This is the hub and spoke model in Hyderabad city. We have a robust governance framework, and a couple of doctors are important to kind of mention about it. Dr. Dinesh Kancherla. Dr. Dinesh has come as a professional to join me, and it's been a kind of phenomenal support for me to build out. He takes care of doctor recruitments as well as oversee the concept of teamwork, and he's kind of with over a period of time he got into promoter group to give a more strength to the organization. And also another doctor, Dr. Anil Dhawan, he was my colleague at King's College Hospital, London. So he joined our board just to kind of bring a perspective of developed countries. And we have bankers, and we have investment bankers and legal counsels on the board. Our board is pretty independent, diverse. I have a very competent, the senior management, key managerial personnel to support the operations and P&L. Mr. Gauri Shankar will do the financial presentation.